Breaking, if you have Medicare Advantage or a Part D drug plan, the most important envelope of the year is hitting mailboxes now. Open it. If you act, you could keep hundreds, maybe thousands, of dollars in your pocket by January. If you ignore it, you could pay more, lose a doctor, or even get moved to a plan you never chose. I'll show you exactly what's inside that letter, who needs to move first, and what to do before open enrollment on October 15th. I read the 2026 plan change notices and the latest Medicare updates, so you don't have to. Here's the clean version, no jargon, just what matters. Sources are in the description, and this is not financial advice. Quick ask. Hit subscribe so you catch every update that can save you time and money. In the next few minutes, what's changing, who needs to pay attention, the forces causing the changes, how fast those changes hit your wallet, and the exact steps to take today. First, what's on the table for 2026? Everyone with Medicare Advantage or Part D receives an annual notice of change, the ANOC, each September. That letter explains how your plan will change next year, your costs, what's covered, and which providers and pharmacies are in network. For 2026, analysts expect bigger than usual shifts. Rising Medicare costs and insurer cutbacks mean more plans may drop certain extras, raise deductibles and premiums, or close entirely. Here are the headline changes many people will see: higher premiums and deductibles, prescriptions moving to different tiers, no longer covered, or carrying higher copays at the pharmacy, doctors or hospitals leaving your plan's network, and reductions in add-ons like dental, vision, or over-the-counter allowances. If your plan is ending altogether, your ANOC spells out special rights to switch plans without medical questions, so keep it safe. Why is this happening now? Medicare Advantage and Part D are run by private insurers. With healthcare costs rising, many are tightening budgets or pulling back. Some companies are already exiting counties or even entire states. One major carrier, United Healthcare, is dropping plans for hundreds of thousands of people in 2026. At the same time, federal rules are reshaping drug coverage. In 2026, the government starts negotiating prices on 10 major prescription drugs. That's good news, but insurers may offset savings by raising costs elsewhere. Bottom line, plans rarely stay the same year to year, and assuming no change is how nasty surprises show up in January. So, who needs to move first? Priority attention goes to anyone who relies on a specific doctor or hospital, anyone taking expensive brand-name medications, people in counties where an insurer is pulling out, anyone who depends on extras like dental or an over-the-counter allowance, and folks on a tight budget where even a small premium hike hurts. If your ANOC says your plan is being discontinued, you have a guaranteed issue right to enroll in a Medigap plan without health questions, even if you live with conditions like diabetes or heart disease. Your letter is your proof, so file it where you can grab it quickly. Let's talk triggers, the signals that change what you pay. If rising medical and pharmacy costs push your plan's math out of balance, then premiums and deductibles tend to go up and networks narrow. If a carrier exits your county or state, then members may be mapped into a different plan unless they choose one themselves. If new federal rules shift drug pricing on those 10 medications, then formularies and cost-sharing reshuffle to reflect it. Those IFTHENS are exactly what the ANOC is designed to surface so you can react before it hits your wallet. In 10 seconds, I'll show you how quickly the timeline moves once those triggers trip. How fast do these changes hit? Here's the pace. Letters land through September. Expect yours by September 30th. New 2026 plan details go public October 1st, so you can compare with real numbers. The official annual enrollment period runs October 15th through December 7th. Changes you make there typically take effect January 1st. If your plan is shutting down, your ANOC will outline special timing and options so you can switch without delays. Translation: the sooner you open the envelope, the more time you have to check doctors, drugs, and dollars, and the less likely you are to get stuck in phone queues. Don't wait until the last week. Helplines get slammed and appointments fill up. quick reality check. Status today: ANOC mailings are rolling out now. Earliest practical timeline: review in September, compare options starting October 1st, and enroll between October 15th and December 7th for a January 1st start. Expect most Part D drug plans to include a deductible in 2026 with a maximum of $615, so be ready for higher upfront pharmacy costs early in the year. Many Advantage plans are trimming supplemental benefits like dental, vision, and hearing. And remember, some insurers are downsizing plan menus or leaving certain areas altogether. What should you do right now? Step 1. Open the letter the day it arrives. Don't let it sit in a stack. The first pages highlight the biggest changes so you can spot any deal breakers fast. Step 2. Check the big 3. Providers: are your doctors and hospitals still in network next year? Prescriptions: are all of your medications still covered at a price you can live with and at a pharmacy you actually use? Priorities: did your situation change this year? If you're moving, traveling more, or managing a new diagnosis, the best plan for you may be different than last year's winner. Step 3. Prepare for enrollment. Plan details are public October 1st. Use that window to compare before the October 15th to December 7th enrollment period opens. Give yourself room to think. Don't push it to the last week. A few money-saving specifics pulled straight from what plans are signaling. Part D deductibles. Most plans will have one in 2026, and the cap is $615, so expect more of your pharmacy costs to show up early in the year. Preferred pharmacies. Your ANOC will tell you which local pharmacies have the lowest co-pays. Staying in that preferred network saves money. Supplemental benefits. A lot of Advantage plans are dialing back dental, vision, hearing, and over-the-counter allowances, so don't assume last year's totals will repeat. Low-income help. If money is tight, look into programs like QMB or state Medicaid assistance. They can cover your Part B premium and co-pays. And one more time, if your plan is being discontinued, save the letter. Guaranteed issue rights for Medigap depend on your documentation. Here's a simple checklist to finish strong. 1. Make sure your mailing address, email, and phone number are accurate with your plan so you actually receive updates. 2. Build a current medication list with dosages and your preferred pharmacies so you can test any new plan against real life. 3. If you're unbanked or changing banks, set up a no-fee account now so premium payments don't bounce in January. 4. If you think you qualify for low-income help, start the application right away. Assistance can take time and it can dramatically lower your monthly costs. 5. Keep a folder, paper or digital, with your ANOC, any notices about plan changes, and confirmation numbers from calls you make this fall. That way, if something looks off in January, you can prove what you were told and fix it fast. Fast recap. ANOC letters arrive by September 30th. They spell out changes to your costs, coverage, and networks for 2026. This year, the changes may be bigger than usual because insurers are tightening budgets and federal drug price negotiations are kicking in. Expect higher premiums and deductibles, formularies that shift, network changes, and trimmed extras. If your plan ends, you have special rights. Use them. Compare options starting October 1st and make your moves between October 15th and December 7th. Start early. It's easier to adjust when you're not racing the clock. If this helped, subscribe for fast updates. Share this with a friend on Medicare. It could save them a headache in January. And tell me in the comments your state and what you'll check first when your ANOC arrives, your doctor list, your drug coverage, or your premiums. I read every comment and use them to plan the next video. End screen is up with a quick guide on reviewing your ANOC and updating your plan in 2 minutes. Your ANOC isn't just paperwork. It's your 2026 roadmap. Open it, read it, and make your moves on time so January starts with the coverage you actually need, not the surprises you don't.